Watch this next video with one of our great partners that's helped hundreds of insurance agents, Medicare insurance agents all across the country. They've been working with independent agents for several years with a wonderful lead program. This video is perfect for some of you out there looking for an answer to your lead questions.
Enjoy.
As an insurance advisor, you face many challenges getting access to the resources you need to be successful, especially if you're an independent advisor. Most advisors' needs will change as their business grows, and eventually, marketing will become your biggest hurdle to a six-figure practice. Gordon marketing agents have access to a turnkey, proven marketing system that targets prospects approaching their initial Medicare enrollment. You can expect to be introduced to 20 to 30 new Medicare prospects a month with our program. All marketing and materials are done for you. All you need to do is show up and present to a room full of prospects. Our team creates each agent a company-branded presentation deck, marketing pieces, and a landing page that will reflect your company and branding. Each agent also gets a client-facing monthly newsletter to help support and grow their book of business. Lastly, and one of the best aspects of the program, is the ongoing coaching and mentoring sessions with successful agents in the program. If you think you're ready to start marketing for Medicare, but you don't know where to start, let us save you time and money with our proven marketing program.
Hi, I'm Rebecca Gordon.
I'm Sylvia Gordon, and if you are like me, you have gotten a call from your client or your client's family saying, hey, my mom just fell, we're putting her in a nursing home, and the nursing home staff sat us down and said, we got to get you off Medicare Advantage. Medicare Advantage is very bad. Why do they say that? Why do they hate Medicare Advantage?
Well, one reason, and this kind of makes a little sense, is it's easier for the nursing home if they have everybody for their prescriptions on one plan.
Agreed.
So
for
like
Part D, that's easy.
Everybody. So that's the benign
to
side.
get you all in the Part D, but they want you on original Medicare, A and B, and a Part D. Why do they want to cut out Medicare Advantage?
I'm going to assume it has something to do with a little bit of money.
Money, right. So nursing homes have a big profit center in therapy. Mm-hmm. And this is the complaint you have. They cut my mom off her therapy. Medicare Advantage is terrible because they shortened my mom's therapy. Mm-hmm. Medicare Advantage is managed care. They're looking at the patient.
They're making sure that they're seeing progression of positive health.
Right.
Otherwise, you need to change it.
So the rule, Medicare rule, says you can get so much therapy as long as you continue to improve. So nobody's watching original Medicare. Mm-hmm. So they give therapy, the maximum amount of therapy, even if the people have not improved at all. If they came in a vegetative state and they're not improving at all, that nursing home can still get paid on that therapy, the maximum, even if they're not improving at all, because nobody's watching.
Nobody's watching.
But managed care says, managed care is not making a new rule. They're following the rule Medicare set out. And they're saying if your patient fails to progress, if they're stuck there, you don't give more therapy because it has no therapeutic value. So then nursing homes want to make the money.
So what should a client do? How does an agent prep their client for something like this, for a future issue?
First of all, you want to educate your clients. You want to try to get your clients to call you first. When they have a problem, call you first. Because if they fall prey to what the nursing home did and they just took them off, put them on A and B and enrolled them in a Part D plan, it's a little hard for you to come in afterwards and try to clean that mess up.
Can they clean it back up?
Possibly.
Okay.
So you want to train, some people hate those words, your clients, when they get any kind of question, trouble, stumbling block, frustration with their plan, to call you. And if you do newsletters, if you have a website, this is something you can try to talk about, because this is a very common thing that they try to take them off Med Advantage and put them on original Medicare only. What does original Medicare only do for your client in a nursing home? It leaves them exposed.
Yeah, 20%.
So they're going to pay 20% for Part B. They have the Part A deductible. So they could pay a lot more. There's no cap on original Medicare than they would have if they would have stayed on Medicare Advantage. So we're just alerting you that there is a problem. It's an ongoing problem. And you can try to get ahead of it with your clients.